Having a great set of teeth, it's really important, especially for properly chewing your food. And sometimes dentures just don't cut it. Dr. Nate Farley, he's from Revive Dental Implant Center. He's here along with his beautiful patient, Mary Cooper, to tell us how her life has changed since she has ditched the dentures. We're going to hear her story in just a moment. But you were telling me, Dr. Farley, that lower dentures, they can be tough for folks.
Definitely they can be tough. So a lot of people are looking for alternatives, and dental implants are a good option. At Revive Dental Implant Center, we have two popular options that are chosen. One is to just get 2 implants for a denture. Sometimes we can use the denture you already have, and that holds the denture in place. The other option is something fixed, and that's what Mary's going to talk about. She went with the option that doesn't come out.
So when you pick up this one more time, and a lot of people who have those dentures, they move around while they're in the mouth, and that's what you were experiencing, right, Mary?
Yes.
You said you've had 4 different types of dentures put in your mouth over the years.
Yes.
What were you experiencing day to day?
Oh, you know what? Since I got this, it's absolutely like I have my own teeth back.
Wow, but before that, what was it like?
Oh, it was terrible. Yeah, the last time, it's been about 5 years since I had my other dentures. And it was just miserable. I couldn't, they wouldn't match up. I couldn't chew food, hardly.
And you said steak was one of your favorites.
Oh, and I wanted a steak so bad. And I couldn't.
Because they were shifting?
Yeah, I couldn't chew. They weren't hitting right.
And talk about just the social part of that. You're out with family and friends and...
Oh, yes. I'm like this. I would talk with my hand over my face, so because it was embarrassing. They were too big for my mouth, for my face, and now these are perfect.
Oh, Dr. Farley, she has been smiling ever since I saw her this morning. Those are common problems that people with lower dentures have. Why did you choose Revive?
Well, I went to Dr. Clifford, who is a dentist in Mesa, and he said, "This is beyond me. You need help." So he said, "I'm going to send you to Dr. Farley and Dr. Howell." And so that's where I ended up.
Can you describe that experience when you walked into their dental office?
Oh my goodness. It was like I was home. It was so refreshing to be there because everybody was so pleasant and so kind, and they just explained everything to me, what they were going to do. And
then now you have this gorgeous
and
smile.
now I have, I'm not afraid to smile.
Yes, no more putting your hand over your mouth. Okay, so fixed dentures, she was a great candidate for that. Who is a good candidate for this type of procedure?
So many people are. You just need to have enough bone to support the implants. As long as you have enough bone, and a lot of people might not think they have enough bone, but there are a lot of different techniques nowadays to get implants for people that have a little bit of bone.
Right, so go ahead and at least make that initial consultation. Do you recommend Dr. Farley?
Oh, absolutely.
He's laughing before I even did it.
Absolutely. They're like family.
Oh, I love that. Does that make you feel amazing?
Oh, it does.
And now, what are you eating? What's your favorite thing to eat? It's almost
listen, I wanted somebody to take me out. I hinted, I want to go out for a steak, and nobody took the bite.
So family's watching.
You look right in that camera, Mary, and you tell them what you want. Go ahead, tell them.
Yeah, well, I had to go buy my own steak and cook it myself.
That is a no-no. All right, for Christmas or Thanksgiving or whatever, give this woman a steak and let her enjoy. You're adorable. Dr. Farley, thank you so much. Great information.